a very small charity I set up in 2009. Rawari is a very small little fishing village on the lake shores of Lake Malawi. There is no electricity, there's no phone reception, and there's no roads. So it's very difficult to get to. Everything is on and off by boat, but it means that it's very quiet. You don't have the sound of the cars, and it feels like you're slightly cut off on an island. I was lucky enough to arrange a meeting with the village headman, and I was just lucky enough to be received very well. We had some very good chats over a few weeks. We also met with the STA, which is the sub-traditional authority. It's sort of like almost the main chief, of which we don't have one in Rawari, unfortunately, but our neighbouring village, Kondowe, the STA there came to join. And I just think it was very lucky. Everyone seemed to agree on what was needed in the area. And we made a plan that we would try and work together to see if we could create a small working environment that would allow some access to educational and to health facilities where there seemed to be nothing sort of before. We thought it was very important at the time that people should be deciding on their own development and what should be included, and that we would help to assist to facilitate that happening. That was the main sort of goal from the beginning. The community donated land for the centre to be built on, which I think at the time was very unused swampland, but it's actually the most ideal location for the centre to be, because it's right next to the primary school, it's right next to the clinic, which fair enough at the time was closed, but we knew we wanted to make an emphasis on health initiatives. We wanted to make sure we could do a nice sort of definitely environmentally friendly set of buildings that people could maintain at a generally low cost. We used rammed earth building as our main building method. Building with rammed earth was a challenge. People were really unimpressed that we were building with earth. They thought we were just building with mud and that it didn't have the right sort of status, and they were completely sure that come the rains the whole building would just sort of fall down. But luckily the rains came, the building stayed, and we had a very big party to celebrate the buildings. And since then, no one's had an issue with rammed earth. We even had a few members of staff build their own homes from rammed earth quickly before the rain started, and that was something I was very happy about.
When Losanism had come here for a visit, she thought of building a community center with the name of providing educational resources and the educational materials to the community. At NYM, the first building down there is the powerhouse, where the solar panels are raised on top. We have the batteries down there being charged by the solar panels. And from there we have the youth club, this big building. This is the youth club, as well as the nursery. And sometimes when we have meetings or occasions, the community come and borrow from us. Can we use our hall? So it also helps the community as well. This is the second building. Then we have 3 rooms. This one and another room there, which is now in the office. And we have another room, the life skills room. Then we have the library. And we have the roundhouse, which is the storage room. Then the kitchen. Then the reservoir, the tank there, up there. These are the buildings which make up the NYM surrounding.
So this is the turbine. The turbine is most useful when it is dark and when it is cloudy. So I'll show you how the turbine works. The water comes from the reservoir, where there's some channels from the stream. When it is full and It works about 6 hours throughout running the turbine. So this is helpful to us at NYM that the turbine is good for us because we don't have blackouts ever.
We have different projects running at NYM. We have the nursery school, because in the past there was no nursery school in the village, so we introduced the nursery school here, and we have many kids learning at nursery school. Then we have the youth club. The second project is the youth club. We run the youth club from the age of 6 to 18, which usually runs 3 times a week. That is Monday, we do education. Wednesdays, life skills and creative arts. Then Fridays, sports. That is the second project, which is the youth club. Then we have the library, of which people from the community can come and read the books for free. They can come and borrow books for free. We don't charge anything. That is free of charge. Then we have the fourth project, which is tutorials. We do English, mathematics, geography, history. So this is the fourth project which we run at NYM, which is tutorial. In addition to tutorial, we do IT as well. Nowadays, we live in the world of computers, so in our village, there are no computers. So with the NYM, we have some computers, so we train the students to come and at least know how to make use of computers. The fifth project is health. So these are the projects which we are running at NYM.
I'm Philippa, and I am the health coordinator for Phunzira. I first came out to Ruawi at the end of 2011, beginning of 2012, to do my elective placement when I was training as a nurse, and just absolutely fell in love with the area, with the people, with the community in general. And a year later, I came on board and took over the role as health coordinator. When Phunzira first arrived, the clinic had been closed for over 10 years, so people were having to walk kind of 4 to 6 hours for access to healthcare and becoming much more unwell than needed or necessary. Dr. Georgie came out and she worked with the district health officers and government members to reopen the government clinic. It's very important that our involvement is supportive and not kind of taking over the clinic. It's a government clinic and it needs to stay that way. She set up a system of kind of doctor rotations, Malawian medical assistants to keep the clinic open, which worked for a short time, but local medical assistants find it very difficult working in Ruawi because it's a very remote area and often they can feel very isolated. When I then came on board, we needed to look at a slightly more sustainable long-term way of keeping the clinic open so that community members had consistent access to healthcare. We worked together with the community and initially brought in foreign doctors to open the clinic so that there was access to healthcare whilst we were working out what the best way would be to make this a sustainable long-term solution. We then worked with officials from the Ministry of Health and identified a local person who had the right grades, and we then sponsored his education to train as a medical assistant. Another initiative that we've worked on, which was really lacking for the community, was emergency referrals for patients. There are patients who come in who are critically unwell, and up until recently it was very difficult to be able to refer those patients for further treatment. So we fundraised for and built an ambulance boat, which serves both Ruawi and Condorway clinics and can be used both for emergency transfers and for referrals for patients or transfer up to Mzuzu or to Nkata Bay. One of the things that we're looking at is continuing to source qualified nurses and doctors to work alongside the medical assistant in terms of further development and further skills, discussing complex patients, looking at management plans and things like that. And a lot of what I do is making sure that the links remain with the Ministry of Health and the District Health Officer here in Nkata Bay to ensure that the equipment and the drugs and the staffing necessary continue to come up to Ruawi so that patients have access to healthcare.
I'm a medical assistant. I'm the overall all in charge here at the facility. I'm having two volunteers who are doing day-to-day work here at the facility, and one who is our ambulance sport driver, one health surveillance assistant. Most of the time they deal with the environmental work and public health, like immunization, child growth monitoring, plus one hospital attendant. I enjoy my job. I had that dream to say one day I need to help my community, but I had no ways by then to say how I can help my communities. And now it's come true that I'm here helping my community. I've conducted deliveries here without essential drugs. And this other lady, during delivery, she started bleeding. We say postpartum hemorrhage. But with a little knowledge, I just applied, things worked out. So it's really a success to me.
NYM is free of charge, but we are also running a small businesses. The small businesses have got the aim of finding the money to support the project. So here there's a couple of businesses that we are running in order maybe you can sustain the center. One, what we are doing here is we do printing. Then the second business that we are doing is a battery box. And the third one is phone charging. We charge phone, as you see on the table. I've got a lot of phones. Then the fourth business that we are running here, we have got a chicken. Yeah, we are keeping chicken for eggs, layers chicken. So the procedure is the same. We sort those eggs to the people. The fifth business is garden. Is we will plant different crops, such as coconuts, then sugarcane, and banana. We have both banana in our garden. Also, we do the same. We sell it to the customers that are willing to buy. Then the sixth business that you are just expecting, DSTV video show. We are sharing profit with the guy who have got TV set, DSTV set, and we provide power and the wall for that. Number 7 is Mesme. And our aim of having Mesme is to sustain the center. If you can add all funds from the 3 different businesses, the center can be sustainable. You can be fair, provide the support to the community.
So for volunteers, I'd say we've been extremely lucky. We as a charity spend no money on advertising. We want the money to go directly towards the projects. So we've just sort of gone through word of mouth, really. But we've been lucky to get a whole range of volunteers, not only in terms of skills. We've had teachers, we've had nurses, we've had doctors, we've had people looking at sexual health education. We've had people coming saying they've got no skills but have been absolutely wonderful in the youth club. We've had a lot of people coming for agriculture, so we've been lucky to get a good range. And also in terms of geographical origins, I sort of assumed most volunteers were going to come from England because that's where my word of mouth would spread. But we've had quite a few from the UK, we've had from Australia, we've had from Israel, we've had from Malaysia, from America. We've just been very lucky. I think it's mainly because for the volunteers we have out, we do not charge a fee. We expect that people are working for free, so why should we charge them extra money? And that has worked very much in our benefit, and it's meant that when people have come, they've not been begrudging of the amount they've spent already.
So in 2014, the clinic had been closed for a year and a half. There was no one providing healthcare in the village, and I opened the doors and started a daily clinic here. I went in on the first day to open the doors and unpack some boxes, and unfortunately dispose of a lot of expired medications. But people were, as soon as they saw an open door, people began to come, which just demonstrates the need that there was in the village for healthcare at the time. I had to unpack boxes and learn to diagnose and treat malaria at the same time. All medications and consultations and investigations at primary care level in the community are free. Unfortunately, resources are extremely limited, so what you do get is very limited. We have anti-malarial treatment and we have antibiotics usually. Sometimes we run out, but we usually do have those basic things. Painkillers, are often at a premium, and paracetamol is often all we have, but we do spend the majority of our time treating infectious disease here. So one of the big attractions to working in Ruarwe, apart from village life, is this beautiful spot where I got to live for 6 months, which is Zulunkuni Lodge. It is secluded, it is tranquil, it is beautiful. Get to swim in the lake every day. It's a piece of paradise with no phone reception, which some people don't like, but for me is a really nice bit of zen and time out from the hecticness of London life that I left behind. For future volunteers, the needs of the clinic would be, from a doctor's point of view, to help and support our medical assistant, who only has 2 years of training, is practically very good and has lots of experience with the illnesses and restraints of working in the area, but can always use the input of people who have more medical training to develop their assessment, diagnosis and management plans of patients. We've no nurse or midwife in the clinic at the moment, so nursing and midwifery input is always helpful as well, just to help develop the service and to help develop practice.
We've also been able to restart the student nurse elective programme, which is brilliant and is something that the student nurses benefit from hugely, to be able to do some training in a completely different healthcare system to the training that they get within the UK. And the medical assistants here absolutely love it, because there's really good information sharing, so everyone benefits from that scheme. So that's really good. So we've had some student nurses coming out as well. One of the things that we're looking for in the future is developing maternity services within Ruarwe, both in terms of education for mothers in the antenatal period, and also in terms of kind of staffing for that unit.
We are very, very, very much happy with what Phunzira has done to us, to this village, because in the past, nursery education, there was none of this. There was none of the youth club. So we have to thank again.
Sindikati walelo kutinza kala woimba, sindikati wambuye wanga kutinza kala hotelo, sindikati wambuye wanga kutinza kala mulaliki, sindikati wainele